The Schizophrenic Spectrum of Disorders. Chapter 1. The Schizophrenic Spectrum of Disorders. Psychotic Disorders Info. A psychosis is a break from reality. The person can't tell whether he or she is having a real-life experience or a mental fantasy. The two most common types of psychosis are schizophrenia, delusional disorder. A delusional disorder is a mild form of schizophrenia. A person has one or two persistent delusions and that's it. He or she shows no other signs of schizophrenia. The most common type of delusion is paranoia. The person feels that others are conspiring to do something bad to them. Delusional jealousy is a person in a relationship mistakenly thinking that every little thing their partner does that's out of the ordinary is evidence that they're cheating. A person with an erotic delusion thinks that some celebrity or high-status person loves them. People with grandiose delusions believe that they have some kind of special powers that enable them to do something great to help the world. A somatic delusion is where the person thinks that there is something seriously wrong with his or her body. Several years ago, people thought Morgellons disease was a somatic delusion. People claimed their skin itched really bad, but doctors couldn't find a medical reason for it. There are drugs to treat delusional disorder, but they don't always work. Delusional people are left alone unless they pose a threat to themselves or others, in which case they're hospitalized. Schizophrenia Info 1. The mental illness called schizophrenia is basically anyone who does not think rationally, which is all of us. Very few people make a conscious effort to think rationally. We are all led by emotions and intuition, but they, the mental health industry, have to make money by finding fault in people. Many people mistakenly believe that schizophrenia is a multiple personality disorder, but although psychological factors come into play, it is more like an organic brain disease that causes irrational thought patterns in people. Schizophrenia is characterized by psychotic symptoms, thought disorder, hallucinations, delusions, paranoia, and impairment in job and social functioning. You're not quite rational thinking. You have some delusions about reality. About 1% of the population gets schizophrenia, and it usually asserts itself for the first time during the teenage years. Some early warning signs are hearing voices in the head, laughing to oneself, talking absurd trash, having visions, paranoia, feeling indifferent to practical matters, disregarding personal hygiene, withdrawal from people. Schizophrenia is a common form of mental illness that generally appears in adolescence or early adulthood, possibly brought on by the hormonal changes of puberty. Some symptoms, called positive symptoms, show a distortion in normal thinking. They include hearing voices, hallucinations, delusions, disorganized incoherent speech, agitation, purposeless and bizarre behavior, and catatonia. Negative symptoms are losses of normal functioning with such things as no emotion, a flat facial expression, a lack of speech fluency, and the inability to do anything constructive. Doctors prescribe antipsychotic medications such as haloperidol, thioridazine, or fluphenazine to treat hallucinations and delusions. Most people who have schizophrenia keep it for life, even though many improve to the point of functionality within society. The causes of the various kinds of schizophrenic disorders are not clearly understood. There is a partial genetic component since the disorder runs in families, but other factors play a part because the disorder sometimes appears in one identical twin but not the other. It could be caused by something that alters the organic composition of the brain or the brain chemistry itself, such as a viral infection early in life or from mild brain damage during childbirth. Some studies have shown that at least some forms of schizophrenia are related to physical changes in the brain, such as enlarged ventricles. Although there has not been a causal link established what causes schizophrenia, large ventricle size and schizophrenia are related. A variety of drugs exist to treat schizophrenia, some with dangerous side effects. The patient must try the different kinds and determine what works for him or her. The disease could go away on its own, or it could last a lifetime where the afflicted person will stay on drugs to minimize the symptoms. The predominant mode of treatment is a combination of medication, therapy, education, and vocational rehabilitation. The primary medications used to treat schizophrenia are called neuroleptics, which are not a cure but a control to help reduce the symptoms. Some of the more common medications are chlorpromazine, thorazine, chlorprothoxine, Tericton, clozapine, clozaril, fluphenazine, prolixin, permital, haloperidol, haldol, loxapine, loxetin, molendon, Mobinit, mesaridazine, Serentil, perfenazine, Trilofone, thiothoxine, Navenit, thioridazine, Melaril, trifluoperazine, stilazine. They work to relieve psychotic symptoms by blocking binding sites for certain neurotransmitters in the brain. Dosage is very important as to effectiveness and side effects. There can be some serious side effects like TD, involuntary muscle movements, and NMS, neuroleptic malignant syndrome, which is muscle rigidity, fever, and nervous system damage. Schizophrenia info 2. The schizophrenic spectrum of disorders are schizophrenia, schizotypal personality disorder. There are journals called Schizophrenia Bulletin, Schizophrenia Research. Schizophrenia is not split personality. It is disorganized thinking that can take many forms. Every individual lives in his own private hell or heaven. I will never know for sure what some alleged schizophrenic is thinking. It affects about 1% of people. When they talk, they don't seem to make sense to a rational thinking person. There might be delusions, fantasies, or simply a temporary loss of conscious thought. Delusions of persecution are usually termed paranoid. A paranoid person can be dangerous because he might kill someone he thinks is threatening him. Most schizophrenics are a danger only to themselves. Schizophrenics seem to have perceptual distortions. When they look at something, it's brighter and louder than what normal people see. You might see a normal cat. The schizophrenic might see a mean, aggressive tiger-like cat. They hear voices and have other hallucinations. Schizophrenics often don't seem to show any emotion. They could be feeling emotions but they don't show it. Sometimes they might display emotions that are inappropriate to what they are saying. The DSM lists 5 major types of schizophrenia. Most schizophrenics are a mix of these categories. 1. Dysorganous schizophrenia, delusions and hallucinations, flat or inappropriate emotional display. 2. Catatonic schizophrenia, times of complete immobility. 3. Paranoid schizophrenia, think someone is out to get them. 4. Undifferentiated schizophrenia, does not quite fit into the other categories. 5. Residual schizophrenia describes someone who was schizophrenic and seems to be pretty normal now. Psychoanalyst says that schizophrenia is caused by a cold, overprotective, strict mother without true love. Labeling theory suggests that once people are labeled as schizophrenic, they fulfill the stereotype. Cognitive theory says that schizophrenics are trying to make sense of what they experience and feel. Humanistic people say schizophrenics are simply misunderstood people following themselves over societal conformity. Schizophrenia could be the result of too much dopamine in the system. The schizophrenia section at the library is at hashtag 616.8982 and RC435 to RC515. Try hashtag 362.20-362-26 or RA790.7 at the library for stories about how to deal with mental illness. Schizoid personality disorder/SPD. Schizoid personality disorder is a condition where the person is unconnected to other people. They don't necessarily feel lonely or alienated. They're just indifferent to most or all social relationships and have a limited range of emotions. This describes most artists, perfectionists, workaholics, and men. Schizoid personality disorder is part of the schizophrenic spectrum of disorders, which includes schizotypal personality disorder and schizophrenia. 4degreez.com/disorder/schizoid.html. clevelandclinic.org/health/health-info. Schizotypal personality disorder. Someone with a schizotypal personality disorder is eccentric to the point of cognitive distortions. It's considered a mild form of schizophrenia. Schizotypal personality disorder is part of the schizophrenic spectrum of disorders, which includes schizoid personality disorder and schizophrenia. About schizophrenia.net. acnp.org/G4/GN40100152/default.htm, the neuropsychopharmacology of personality disorders. Schizo websites. Schizophrenia.com. nih.nih.gov/health/publication/schizophrenia, schizophrenia, booklet from the National Institute of Mental Health. narzad.org, National Alliance for Research on Schizophrenia and Depression. aacap.org/publication/facts/fam/schizo.htm, schizophrenia, ASAP Facts for Families brochure number 49. About schizophrenia.blogspot.com. beartwinsmom.wordpress.com. coloradorecovery.net. dr-robert.com. esccs.uw.hu/schizophrenia/schizophrenia.html, schizophrenia, advice for diagnosing yourself. fenichel.com. holisticschizophrenia.blogspot.co.uk. schizophrenia-help.com, Schizophrenia Help Resource Center. medicine.net.com/schizophrenia/article.htm. nami.org/disorder/990305.html, genetics and schizophrenia. nami.org/disorder/990305.html, genetics and schizophrenia. nami-newyork-metro.org, National Alliance for the Mentally Ill, Metro New York. nimh.nih.gov/health information/schizophrenia menu.cfm. nimh.nih.gov/publicat/sges menu.cfm, schizophrenia, 32-page free online booklet. power2u.org/evidence.html, evidence that people recover from schizophrenia. psy.med.rug.nl/0012. psy.med.rug.nl/0031. psychguides.com/eks_sche.htm, expert consensus treatment guidelines for schizophrenia. psychiatrictimes.com. psychiatrictimes.com/p020537.html, treatment-resistant schizophrenia, making the determination. psychiatrictimes.com/p950112.html, young investigators present schizophrenia research. psychiatrictimes.com/p950627.html, new findings in psychobiology and course of first episode schizophrenia. psychiatrictimes.com/p990419.html, ACNP focuses on recent treatment advances. psychosisbook.com, defeating schizophrenia. schizoeffective.org. schizophrenia.ca. schizophrenia.com. schizophrenia.com/elizigns.htm. schizophreniadigest.com. schizophrenia-help.com. schizophrenic.com. socsi.med.rug.nl. successfulschizophrenia.com/links.html. szmagazine.com. understandingschizophrenia.com. docgmsplashfly.blogspot.com. unlistedfilm.com. utk.edu/communication/discussion-group/mental/schizoph. vaxxine.com/schizophrenia. webmd.com/schizophrenia. worldschizophrenia.org. world-schizophrenia.org. world-schizophrenia.org. yale.edu/via-le. National Alliance on Schizophrenia and Depression. 60 Cutter Mill Road. Number 404. Great Neck, New York, 11021. 516-829-0091. mhsource.com/narzad.html. National Institute of Mental Health. 5600 Fishers Lane, Rockville, Maryland 20857. nimh.nih.gov/publicat/schizoph.htm. Free booklet Medications for the Treatment of Schizophrenia. National Mental Health Association. 800-969 MHA. nmha.org. Schizophrenia Society. 814-75 The Donway W. Don Mills, on M3C2 × 10 to the power of 9th. 416-445-8204. Fax, 416-445-2270. 888 SSC Hope. Schizophrenia.ca. Superintendent of Documents. POG 371954. Pittsburgh, Pennsylvania 15250-7954. Access.gpo.gov. Quarterly journal called Schizophrenic Bulletin, $20 per year.